Hello and welcome to the Wisconsin Council of Churches Love Builds Up Vaccine Clinic Training. My name is Reverend Brianna Elene, and I am the Content Curation and Ecumenical Innovation Coordinator at the Wisconsin Council of Churches. It is a long title, but means I do all kinds of fun things like hosting webinars. So tonight I will be your host through to the discussion, and assisting me tonight is Ian Biddle, who is one of our vaccine outreach community organizers. And so he's going to be helping out. And so if you haven't introduced yourself, go ahead and introduce yourself in the chat. And this will help us keep track of what's happening and what kind of questions you might have. If you have a question at any time, I invite you to use the Q&A button at the bottom of your screen and enter it there. Or if you enter it in the chat, we can go ahead and do and get that. So if you hit the Q&A button at the bottom of your screen, that way we can get questions that you may have for our panelists up to us. Hey, Ian, I'm just gonna, if you are able, can you text Dan and see if he can get Omar the link again so that he can get in?
Got it. Okay.
Thanks, Ian.
No problem.
So as I said, if you want to hear this training in in Korean or Spanish, that is available, and you just need to click the interpretation button in your webinar settings and select the appropriate language. And then finally, if you miss something or you need to leave early, don't worry. This is being recorded in multiple languages, and so it will be available on the YouTube channel next week, the Wisconsin Council of Churches channel. So what we are going to do tonight, I'm going to put in the chat our agenda. And so it looks like this. We are waiting for we're missing our panelists for our providers. So we're going to go ahead to our COVID vaccine clinic hosts. We've got a bunch of folks here whose churches have hosted vaccine clinics. And so they are going to tell us about their experiences and give you kind of a rundown. And we have a variety of settings and a variety of people who've done different things. And so this will give us some time or some ways for you to think about your context and what this could look like for you. For those of you who don't know, the Wisconsin Council of Churches is a network of Christian churches. We've got 21 member denominations and a bunch of faith-based organized nonprofits that are also members of the WCC. And they are committed to working together across many differences. Exercising holy imagination, we help each other make courageous choices that lead towards peace with justice, the vitality of the church, and the well-being of our neighbors. In that last category, the well-being of our neighbors, our COVID vaccine community outreach program aims to break down barriers to vaccination in information, concern, and access. And that's where you all come in. And so we are super glad that you are all with us here tonight. So we are going to go ahead and start with some folks who have hosted vaccine clinics in their churches. And so we've got 3 different churches, or 3 different kind of community organizations, churches. And so I'm going to go ahead and start with our first one. Leaf, would you tell us who you are and what you did?
Hi, I'm Leif Peterson, Executive Director of Grace Welcome Center. We're located in Uptown Kenosha at Grace Lutheran Church. We have a day program that has been going on for 4 years and a food pantry that's been going on for about 2.5. We're continuing to look for ways to help lift up our community. About 60% of the people living in Uptown are living below the poverty level. There's many homeless and many, many more near homeless individuals in our area that we're serving. In March, early March, I saw that in the newspaper that our county health director had just met with Governor Evers. And she was lamenting, even though she was able to get vaccinations to many of the folks in Kenosha, she was looking for ways to reach into the inner cities, the minorities and the poor people in town. Having read that, I sent her an email saying that we would like to help. We have a good standing in town with that community because of our food pantry. And I thought it would be a very good partnership. She responded a week later saying that she would love to do that and had a number of doses of the Johnson & Johnson single dose, which was perfect for our group. She reached out to me on a Thursday. I said, well, great, let's do this in about 10 days or 2 weeks so we can get the word out. And she said, well, it has to be by Tuesday because we have to, she wasn't sure that she was going to get any more doses. We had to make a decision right then and there. So we agreed. She came and toured our church on Friday. Logistically, we had to plan out how this was going to work with people entering the church, getting into the sanctuary for vaccinations, keeping people spaced out, and running our food pantry, which was running about 180 households at that time, each Tuesday afternoon. So we gathered up a number, we put out a call, we got a lot of extra volunteers. We normally have about 20 some volunteers on a Tuesday afternoon just for our food pantry. We got another 8 volunteers to help translate because we have a lot of Spanish speaking people in our neighborhood. And we needed more people to direct traffic, et cetera, and keep people safe throughout the building. In the first 2 weeks that we did this, in the end of March, I think we vaccinated about 400 people just in those 2 Tuesday afternoons. And at the same time, we're running our pantry. So we had a crush with traffic and individuals were lined up around the block. I'm waiting to get into the church. As an extra incentive, I decided it would be good to have gift cards available to those coming in as just to twist our arm a little bit because there was some hesitancy, especially in the African-American population, to get vaccinated. So we put out a call and we got help from Outreach for Hope in Milwaukee. They gave us $500, so we turned that into $10 gift cards at Quick Trip, which is nearby, and we passed those out. While people were being vaccinated, they were using their cell phones to contact their friends and family to come down and get a gift card, so that worked very, very well. Based on the first week, we had to do a little fine tuning to keep the process going smoothly and to maintain spacing, but we were able to do so. The second week, we got about another 150 people vaccinated, and we got a $500 donated from First Baptist Church in Kenosha. They believe strongly in supporting what we were doing. So we were able to give gift cards the first 2 weeks. We continued that up until, I think we had 5 clinics up until the Johnson & Johnson was put on hold. And that was for a 2-week period. We were open for 1 week following that, but the demand was very, very low. Few people were coming after that. So basically we had 5 weeks where we gave vaccinations to the community. We gave out, I believe, I should say 780 people were vaccinated from the streets. Most of them near homeless, very impoverished people. Of that, 70% of those were Latinx, and that's why we needed the translator. So many people coming to us were not registered. They didn't have green cards, but they trusted us, so they came. The health department made it very simple. They only required a name, so they didn't have to show any identification where they were living. They just had to give them the word that they were living in Kenosha. And that's the information that they forwarded to Madison to acknowledge that the doses were given. So that was highly successful. We are still working with the health department in Kenosha. Juneteenth celebration just a mile north of us. We're going to be giving, we don't have any money at this point, so we're going to be distributing through Threads of Hope. We had gotten a lot of Harley Davidson shirts and tops for men and women. So we're going to be giving out shirts and tops that are list between $40 and $80 in value per. And if they get vaccinated, they'll be able to choose an item of clothing. I also wrote for a grant and received it from Aurora Hospitals in Kenosha. They were giving out $1,000 to individuals or groups in the city that were going to work with vaccinations. So that check should have been cut today. And we're going to work with the health department, setting up some more clinics now on the street where people hang out during the day. They're happy to get them in smaller groups. There's no large vaccinations being done anywhere in Kenosha any longer. But we're going to be giving out this time $20 gift cards and more Harley clothing to convince people that they should get vaccinated. And that's where we're at right now.
Great. Thank you so much. So now we are going to head over to Mequon, another part of the state. And so we've got a team of folks here. And so I'm going to ask you guys to introduce yourselves and tell us a little bit about what you did.
Well, I'm Connie Pouquet, and I'm the president of the Board of Trustees at our church. Karen Hoffman is our treasurer, and Susan, whose name just went out of my head, Susan?
Culverson.
Culverson, thank you. That's a problem for old people, you know. But Sue is the chair of our parish nurse program. And we three worked together to set up clinics early on when people were desperate to get into clinics and couldn't get appointments in many places. And we recognized a need to work directly with individuals and set up appointments so that they would feel safe coming in. So we did it differently. And Karen is going to speak to the process we went through.
Yeah, we started out in early February. We have an older population of folks in our congregation. So we started out wanting to find a way to vaccinate the people in our own congregation. And we were told that Omar Aliwa, who owns Welltopia in Thiensville, would be willing to work with churches that would host these clinics. So Connie looked into it. Then the three of us talked about how it might work, and we sent out an email to, we set up a dedicated email, and then we sent out a notice to people in our congregation just to gauge interest, because at that time, you know, there were eligibility requirements. It was early February, and just the people over 65 were eligible. So Karina, who works with Welltopia, came on over, looked at the church, and then we talked about ways that we could get this up and running. We had a similar situation as you, Leaf, in that we had a very fast turnaround. Once we had an idea of how many people were interested, the pharmacy was told, I believe, on Friday they could order the doses. And then on Monday evening, kind of got a call that they would be ready to go on Wednesday. So we had a very fast turnaround. And what we did at that time, which worked very well for us, was really focus on developing a personal connection to people. So when we were getting emails and phone calls, we followed up personally with each and every person. And at that time, people were so grateful because, you know, we were talking about seniors, many of whom tried to get online and sign up at different places and were really having a difficult time. And many of them had medical conditions and other ailments that really complicated things. And so they were quite grateful. Anyway, so what we did in the very beginning is relied on personal connections, spreadsheets, very, very rudimentary scheduling system. And we also limited the number of people that we had volunteer because We really wanted to be very deliberate about how we laid out the facilities and who was involved and what responsibilities they would have. Susan Salverson, who's on the call here, was instrumental because she heads up our parish nurse program. So for our seniors, they not only trusted in the individuals in our church, but they trusted the nurses who were involved. And so we had this nice link between Connie and the nurses and the pharmacists. And with that, we decided, or we worked on how many people would be make sense to run through at a time. When we first started, we had no idea how long it would take people to come through, fill out the paperwork, get vaccinated, wait 15 minutes and leave. So the very first clinic, I think we did 24 people an hour. It was a little bit slow. By our 10th clinic, we were running through 60 people an hour. We were doing 6 every 10 minutes just to space them out. What was nice about our church was that it was a comfortable environment for these seniors. We had handicapped access, we had ample parking, we had a lot of space. So the church was comfortable for a lot of these people. This was way in the beginning. It was very new and very scary. By the end, by our 10th clinic, we had evolved and we weren't so concerned about eligibility. And we morphed into using Sign Up Genius as a way to get people to sign up, and they could sign themselves up through our website or through a link in emails that we sent through the Chamber of Commerce and the businesses, HR departments locally, country clubs, anybody we could circulate it to, we did. So
we started getting students too. See that the eligibility expanded as we were doing the clinics. And a noted difference between Leaf's operation and ours is that he was working with a health department that said, we don't need to do a lot of paperwork, we just need to take names. And we were in a different time frame, and our people were required to provide identifying information. So we had a lot of paperwork to do. And I think now the requirements have changed, and the eligibility is wide open. So I think it would probably be a lot simpler now to operate the kind of clinic that we had. But I do think people, as Karen said, people were very comfortable and trusted not only our church volunteers, but most specifically our nurse volunteers. There was I think a lot of confidence in having a nurse there. There were some people who came in and they were afraid of the vaccine and they were afraid of the shots. And they were concerned that something might happen. And having Susan and her team of parish nurses available really gave people confidence. Don't you think, Susan?
Yes, they had the opportunity to ask us questions. We could waylay misinformation, urban myths, I call them, things they heard from somebody who told them something about something. So it was very nice to have the one-on-one chance to talk with people, as we had a really nice layout for moving people from a paperwork section to a waiting section to a going in and getting your vaccine section. And at that point, nurses could talk to each person one by one and say, do you have any questions? Can I see your paperwork? And they would tell you if they were afraid or that they had heard that their DNA would be changed. What did I know about that? So you could really give them one-on-one information. And then at the same end, since we had the Pfizer vaccine, everybody had to come back for a round 2. So that we learned very early on that even though we told them everything they needed to do, until they had something in their hand that they could carry out with them, so we made a handout, to remind them of the things they needed to do when they came back. That really made a difference and decreased the time frame on their second trip around. But while they were waiting 15 minutes, there was time to do that. And they could, again, ask questions, and they'd heard about side effects and what could you tell them? What would their experience be like after they got the vaccine?
Omar is with us. You saw that, Brianna?
Yes, we'll
I-
invite him in a moment.
Okay.
Yeah, that does bring up an important point, is that working with Omar, with a pharmacist, a local pharmacist, was also very important for the success of the clinics, because we had to work with them each week to, or before each date, to determine how many, especially in the beginning, how many doses would be available. So there was quite a quick turnaround trying to match the doses that were available to the number of people that were eligible at a time. So one of the things that was advantageous to us was that we are part of a consortium of churches for Family Promise. That's 13 churches in Ozaukee County that work together to address homelessness. And that was, we also reached out to those pastors at those churches and asked them to speak to or reach their congregants to see if they were interested in being vaccinated as well. So we tried to leverage up our networks as much as possible. I think Omar, by the way, is
I'm
is
talking
typing
to
it to me.
So I'm gonna invite Maureen to share, and then we'll invite Omar after that. But Maureen, would you please share your experience of
Yeah.
hosting a clinic?
So we're in Washington County, we're in West Bend. We're still at only 44% vaccinated. So I'm in a situation where there's a lot of resistance. I wish I was in Ozaukee County. So I had worked really hard with my congregation, and my congregation is all vaccinated. They wanted it. So in the beginning, I was helping people with just getting them signed up for things, helping them, opening my chart accounts for them if they didn't, whatever I needed to do to help people overcome their issues with technology. And then after Brianna did her pop-up clinic, I was so impressed that I called Hyatt and said, hey, my church would like to do that too. So we reached out. We had flyers in English and in Spanish. One of the important things I learned doing that was the importance of having a good translator. I had one translation that just wasn't very good. I showed it to somebody else, and she said, nobody who's undocumented is going to show up to your clinic if it's worded this way. They're not going to feel safe. So it helped us to make connections in our community with Casa Guadalupe and the Albrecht Free Clinic. And we did a Family Promise as well. And in the end, we still only had 10 people. But it was early May at that point, and that's kind of around the time that people stopped going for vaccinations. But I had people calling me, people who were afraid, people whose husbands didn't want to let them go get vaccinated. And so, you know, if any of those people felt encouraged to get it, whether they got it with me or not, it's okay. We still felt like it was a success, even though we had only 10 takers. And, you know, I'm looking at the chart right now, and there's a lot more people out there that could still get the shot. So.
Yeah, thank you. So let me bring myself back onto a spotlight. So we have Omar, who is the owner of Welltopia, and I'm going to invite you on screen to share a little bit, some of the knowledge you have as a provider. What are some of the things that churches need to be thinking about when they are hosting these clinics and kind of helping to get vaccines out there?
Hi, my name is Omar. I'm sorry, I think something is with the camera. It's not allowing me to share my face, but you're gonna hear my voice. So one of the things that happened when we came to the Methodist Church is that we found that they were very well organized. They had the contacts of people to contact. The message was very clear to the people who came to get the vaccine in the congregation. They knew what they signed up for. They knew how long they need to stay, and it was very well organized. Me and Karina say that it's by far the most organized events that we had, and we gave like 11,000 vaccines or more. But what was happening is that every week we would request the number of doses that we would be bringing, and we would get a clear number. And usually the number that we give the vaccines was like 3-4% plus or minus. It was very accurate. And we use our PR system, which is Karina Chelsky, who works with me. We're very fortunate to have her work with the vaccine distribution center to get us the vaccines that we needed, because many times there was not available vaccines, and we would hunt for vaccines, and it was not an easy job. But then we would come and we would try to meet the expectations. We would bring 1 or 2 vaccinators as needed. So some of the things that the church need to think about is that there is access to people. There's trust that's built between the church and the people who visit the church, the place of God. Like, people believe that this place is going to give us good advice. This place is going to communicate with healthcare professionals who are going to straighten out the information that can be misinformation. So we found this happening with the Methodist Church. Also organizing the paperwork, making sure that when I am a vaccinator going to give a vaccine, I have the consent form, I have the ID, I have the insurance. I don't need to worry about that. I just check the information, make sure that the patient is going to take the vaccine. Are they a candidate or not? How long they're going to stay, 15 minutes or 30 minutes. There is a specific place that they can stay spaced out. So these kind of little details is what make or break a vaccine clinic. And then the organization of the second vaccine appointment, because J&J vaccine, I was just hearing that it was available at that time. It was not available anywhere. So we had to schedule the second vaccine. So giving the information, the piece of information that you're going to come back in 3 weeks at a confirmed appointment, and this appointment is confirmed. If it changes by any means, you'll have to communicate with 100 people or 90 people or 200 people to tell them that other appointment. So we learned the hard way that we have to communicate 2 appointments, not just 1 appointment, if it's a Pfizer or a Moderna vaccine. And then we learned also that the church can outreach and do other things, because some people cannot come to the church to get the vaccine. They can't leave their house. So we opened our homebound vaccine appointments that we do for patients who are living, who like cannot leave the house, homebound patients. And then we wanted to communicate that to the churches as well, to let us know if someone would need this service. There is some details that we can talk about, but I think sky is the limit when it comes to availability of health services that can happen through the church, something like the vaccinations. I think in a nutshell, organization, paperwork, confidence, and promises that can be met. That's what we saw with the Methodist Church, and we value this invitation. We value every time that we came. It was always a blessing. It was always a breeze for us, because we knew that this is going to be a good day and easily organize the day. And we had a couple of moderate allergic reactions that occurred on a couple of occasions, and the team was very professional. We worked back and forth. We had the confidence from the church that they know what they're doing, we know what we're doing, and it was very easy to be well organized.
Thank you so much. And we are going to drop in the links, or in the chat, a few links. There are some guides from the state and the federal governments that have checklists. The first is a guidance for community and faith-based organizations from the state of Wisconsin. And this outlines different ways churches and other organizations to contribute to the vaccination push. In there, if you scroll down, there's a section on planning a vaccine clinic and how to get things rolling. One helpful tip is to advertise the clinic beforehand, putting on an informational session for the community. And then it says in the guide to reach out to your local health department or an approved vaccine provider, such as Welltopia, which we had represented tonight, or each community kind of has different providers that can help. This also has an extensive, oh, Ian also put that in. Ian, if you want to put the second one in, the second one is a checklist from the state that can help you with the planning process. This is not a rigid set of rules. When we looked at this originally, we had, I said, whoa, this is a lot. This can be a little intimidating. But the reality is this is something to think through, to have read through, to say, these are some of the things that you need to have covered, but it doesn't mean you need to necessarily have them all, but can give you an idea of what you want to think through. And then the third one that Ian will put in the chat, it has come from the federal government. And this is also a quick guide for churches and community organizations, including instructions on how to connect with vaccination providers in your area. And so we will also email these out to people who've registered when we email out the link. But these are kind of, we've all talked at you for about 37 minutes and maybe you forgot to take notes or you're like, well, how did that work? These offer some checklists of some things to think through as you might want to set one up in your church or your community. So I'm going to pull forward or pull you all back, all our church host people back on the screen, and we're gonna all kind of do this a little more casually of to finish up with our questions. I think I have everyone now.
Brianna, just one thing that Karen, Susan, and I talked about, the fact that we're more than willing to work with any church that wants to begin the process of planning in their community. We'd be willing to help.
Yeah, so Mequon United Methodist Church is a resource.
Yeah, I would do the same thing, especially if it was another church in Washington County. Wanted to reach out to me. We could even maybe do a joint clinic going forward.
And we have staff at the Wisconsin Council of Churches. Reverend Dan Schultz is our project coordinator. And so reaching out to him is also a way that can help. We can help get you connected. He's been networking all over the state. And so he's got the contact information of these folks. And then he's got lots of other contact to get you connected where you need to be connected. So one of the things I want to ask you all is, what do you wish you knew before you had hosted your vaccine clinic? What do you wish you would have known that you kind of learned on the fly? And then what do you think what do you wish you would have done differently?
I don't know that for me, if we had been stymied by things, we wouldn't have ever done it. But we weren't. We saw a ministry, a mission that needed to be done, and we figured that we could do that. We had a great partner in Welltopia. They were willing to bring the vaccine. The least we could do is get people there and organize it and keep the people safe. We just did it fairly simply that way. Omar told us what information he needed, and we figured out a way to capture that information. Karen, Susan, is there anything that you wish you had known ahead of time?
No, just having the handout was a key, but I never even thought about it at first. We just kind of were flying, and with the quick turnover that we had, where on Monday night, Karen knew that where we had in Welltopia was going to come with 100 vaccines, and it was phone call to 100 people to get them all scheduled and come in. So I think we just kept evolving as things moved along, and Welltopia was a great partner, just an excellent partner.
And we
Yeah.
did it better and better as we went, you know, I mean, you kind of just jump in and do it.
That's kind of the experience we had as well. And by the way, Grace Welcome Center, we'd welcome any inquiries on how we set things up, and we're willing to work with anyone that would like to get things started. We didn't have much of a chance to think about it. I had about 15 seconds to say yes or no to the health department, and I'm glad I said yes, and our team jumped in with us. We made strategic decisions that actually worked. We had to do very little fine tuning after the first one. Thankfully, there's a large sanctuary and a large church building, so we could keep people spaced out. We had enough volunteers. We had to keep asking for more volunteers, but we kept everybody safe. And those that were engaged the volunteers found it extremely rewarding. People that had not been involved in our ministry before really are hooked with this. And it was a great story for the community too, how we were able to open our doors for this. But it was key because we were trusted by the community that we serve. And that's why they came forward. So if you've got the trust in your community, it's easy to make it happen. If you're new kid on the block, it's going to be a lot harder to get things started. But it went well. And I'm glad we jumped into it.
Or if you're in a community where belief in the need to be vaccinated is limited, then and that's what Maureen's facing.
Yeah.
And Maureen, I feel like you might be representative kind of where if someone were to host a vaccine clinic today, it'd probably look a lot more like the hard work that you're doing.
Mm-hmm.
Right. I mean, you know, you have to count it as a victory if only 10 people show up, especially if they were 10 people that kind of decided on the fly, okay, I'll do it, and decide to come in. And, you know, and part of it too, that we saw as a really victorious thing was it was a new project for our church. I'm new here. I took this call during the pandemic. So it was like a way for us to make connections the church hadn't made before in the community.
Sure.
It takes time to build trust. So if you do something, you have to look at how to measure your success. And it might not be numbers, but now that I've done something and kept my promises with Casa Guadalupe, with the Albrecht Free Clinic and other groups in town, that's like some trust money in the bank for me for our next venture out into the community. And so we've done some other things not related to vaccine, and we're getting, you know, well received now. So, but I encourage anybody who's in a place like where we are with such a low vaccine rate, if you want to try this, do it. The pharmacist wasn't mad at us that we only used 10 vaccines. They said this happened everywhere. That was how it went that week, as people were shifting. I feel like in some places like where we are, everyone that wanted the vaccine really wanted it.
Right.
Because there weren't very many, I mean, the businesses and stuff around here never really shut down. It didn't feel safe to people here. So we did our part.
And I think that's kind of where it's going to be from this point on, maybe 10 or 15 at a time. The days of getting large groups of people are far behind us.
Totally agree.
I can share. So I think Maureen mentioned that I also had hosted a vaccine clinic at my church, and I felt like we happened in the time when everything kind of opened up to have a lot more availability. And so we hosted a 2-shot clinic, and the first shot went out the night before. Oops, got some echo. And the night before the news went out, and I had 500 people gathered or like lined up around the block who got vaccinated in our basement of our church. I think it was 3 weeks later, we had people come back for their second shot. And we also had 100 Johnson & Johnson shots. And this was, I can't remember at what point it was, but nobody showed up because they could walk into the Alliance Center or the big places downtown. And so there's just been this big shift on how we're doing vaccination now. So the final question I have for you, and I've got a couple questions in the Q&A that I think I'm going to ask Omar to answer. But while I have, and if you have more questions, please put them in the question and answer section. But while I have you guys here, my question for you is, why is it important that churches do this? Like, what's the importance that it's the church stepping up hosting a clinic when there are all these other places that are hosting them, including I've seen people doing them at bars and doing them at like I think the Bucks maybe were doing a clinic. So they're kind of happening all over, but why should the church be doing this?
Well, at least when we did it, it was a matter of trust. People were still really scared about the vaccine. They didn't know whether they should get it or not, but they thought they should because everything was shut down and they couldn't leave their homes. You know, they wanted to be protected, but they were afraid. And I think the church, the fact that we were doing it in the church, we were doing it with professionals, and having nurse backup as a part of the clinic, I think it just gave people confidence in coming in. They were comfortable coming in. They weren't going to a medical clinic. I think comfort and trust are the reasons. You know, for the young people, maybe going to the Bucks is okay. You know, they can get a free ticket, and if that gets people vaccinated, that's wonderful. But I suspect in some of the rural areas of our community, in particular, perhaps in some of the urban areas as well, churches are trusted, and that's a reason to offer it. That's my opinion anyway.
It's a great opportunity to mission, and churches have space. They typically have space. We had space to spread people out, parking, great logistics to work with.
Churches also provide safety. So, you know, I was thinking about like, who are all the people that are falling through the cracks? What if people have a warrant out for their arrest? They should still get vaccinated, and they might be afraid to go and do that at an official looking location. That it's kind of an extreme example, right? But maybe not. So who are the people that are anxious about going to something that looks more like an official spot? Those people might understand that churches are a sanctuary. I also think too that churches took a lot of heat for their reaction to the pandemic. I heard a lot of, well, I can go to a bar, why can't I go to church? And so this was a way for churches to have a positive public response to the pandemic, that we didn't just roll up the carpet and turn off the lights and hide. And so it's a good kind of re-entry into the public sphere for a church.
I think for us in our church too, again, the personal connection was really important. And we tried to accommodate people who had special needs. So when we had some people who were developmentally disabled and their family were bringing them in, we took special care of those people. If they needed extra time, if they needed handicap access, if they needed a little bit of reassurance, we took the time to cater to their needs because that's our calling. And I think that some of those people would not have felt as comfortable or would have been able to go to one of the mass clinics or a larger space and feel comfortable. So that was something else that we did that perhaps people wouldn't be able to do at a large pharmacy or a large place, a mass clinic. And again, it's that feeling of comfort and safety, as you said.
along that line, we had, as an example, a brother bring in his developmentally delayed brother, because he said he lives alone, but he wouldn't know how to negotiate getting into a clinic, and he wouldn't understand how to give the information and that sort of thing. So he actually went to an urban area quite some distance away to bring him back to our church for that clinic, because he felt that his brother would be more comfortable in our church. So I think that's just the population we served.
For us, it was largely because of the trust we have in the community. As I stated, so many of the people that came to us were undocumented, and they trusted us enough to show up and have that done. But we're also serving the community with our food pantry, with our shower program, with emergency clothing. We help find shelter for the homeless during the winter. So it's part of what we do anyway. It was a natural way to continue that. And it was great partnering with the county.
Yeah, it is. There's so much happening, and it's all about building trust. And one of the things we found at our clinic as well, when my church hosted it, we hosted it on a Sunday morning. Ironically, our church was closed because we were still all online. So I was upstairs with my worship leader leading worship in the sanctuary, whereas downstairs, the church was open for the first time in 13 months with 500 people walking through getting vaccinated. But I had someone reach out to me and say, hey, my brother couldn't find an appointment because he works 9 to 5. And so churches often are able to offer alternative times too, which can be really helpful, whether it be a Sunday or a Saturday or an evening time that maybe a regular clinic isn't open. So I want to say thank you. Is there anything else our panel wanted to say and wanted to share?
Are there
I
any
just want to.
questions?
I'm going to invite Omar then on. Anyone else up here? Okay. So thank you guys for your ministry. And I am going to invite Omar on. He's been in the chat answering some questions, but would you be willing to kind of answer those live as well and talk a little bit about some of the questions that folks have brought up this evening?
Yeah. So I had the last question that I answered was about the liability of the church. And from what I know as a pharmacy, when I come to vaccinate, it's as if someone come to my pharmacy. So everything is under my liability as a vaccinator. And I report anything that happens in terms of adverse reactions or kind of using EpiPen, or let's say I vaccinate, my intern vaccinate. We would not allow a nurse practitioner present with a vaccine who is a vaccinator to vaccinate under our jurisdiction, not for any reason, but just because it's as if you're being vaccinated at the pharmacy and I'm responsible for this vaccine. So I think when you invite an entity to come vaccinate at the church, it's their liability. So I just want to make sure that you understand it's an easy ongoing thing that has been always happening for the flu clinics, for instance. And I want us all to remember that in September and October, there is going to be, in November also, there's going to be the flu clinics, so we can plan ahead for these events. And if the churches were able to get 100, 200, 300 people for getting the COVID vaccine, I think the flu still, it kills a lot of people, and a lot of older folks are going to need those vaccines. So think about arranging those vaccines. I want to say that we are one pharmacy, but I had 5-6 vaccinators that were ready to go anywhere on Wisconsin. And we actually, one time we ordered 4,000 vaccines and we had to return them because the company or the factory that wanted those vaccines didn't want to get vaccines anymore. So you can reach out to us, and we also connect with other vaccinators if we're not available. But there are people out there who are willing to travel to places, who can go to Racine, who can go to anywhere in Milwaukee area. So it's like kind of, it's just an idea of outreach and trying to find answers. Other thing I want to say is that the vaccines are available now, and I'm gonna talk about myself. I think also other pharmacies would do this, but we now travel and we go to places to give 5 and 10 and 15 vaccines, and we administer the J&J vaccine and the Pfizer vaccine still. So it's an ongoing thing, and we have to always think of those people who cannot leave their houses always, because we are as strong as the weakest link in our community. So that's something else that we can think of. I don't remember the other questions. If there is anything that I need to answer, just let me know, Reverend Brianna.
Someone had asked about if you need a freezer. I remember
That's
originally there was this story like, oh, they need to be kept super cold. And so do you
okay.
need to have special equipment?
From day one in vaccination, no one needed a freezer, because the Pfizer vaccine only needed to be kept in the fridge for 5 days, and the state was delivering the vaccine every week, so it would be good for 120 hours. But currently the guidelines have changed. The Pfizer vaccine can stay up to 45 days expiration date in the regular fridge, so no need for a freezer. And for the Moderna vaccine, I think since day one it was 30 plus days as well. And the J&J vaccine have also more than 30 days on their vaccine to be kept in the regular fridge. So we bought a freezer and we kind of never used it because there was no need to use it. In the beginning, it was like a must if you need to keep a large number of vaccines, but now there is more flexibility. So logistically, it was a nightmare in the beginning because you have to use all your vaccines in 120 hours. But now there is more flexibility, and Pfizer and Moderna have done really good studies for the stability of the vaccines.
Well, thank you so much. Thank you to Omar. Thank you to our panelists and all our church folks, and thank you to our translators who've been translating in the background. So we'll conclude tonight with a couple of suggestions for next steps. First, you want to take what you've learned back to your community. Is this something your church is being called to? Do you have access to a community maybe that hasn't been vaccinated yet? Even in cities where there is huge vaccine uptake, there are communities that have concerns about vaccines, maybe are still kind of waiting for that place to be convenient, that place that feels safe, and maybe that is your faith community. So take it back to your church board, your administrative council, whoever that may be, and discuss it with your stakeholders. And then Ian can go ahead and put a link in the chat. This is a place that you can sign up to be matched with a vaccine provider in your area. And maybe people are still hesitant. Maybe you need to organize a question and answer session. I know that I had lots of questions as I started learning about this, and many people do. And so maybe you host a question and answer session. One of the things that we are developing here at the council is an empathetic listening session, or an empathetic listening training. There are people who have concerns, and they're real concerns. There is mistrust, that sort of thing. And so we want to equip churches, or specifically churches kind of where we're working, but churches and communities to be empathetic. What we found is it doesn't work if you go in and be like, well, here's why you get the vaccine. That often turns people off. Instead, we need to enter as people who listen. And so we are going to be hosting a trainings for your church community so that you can learn how to do this. How do you listen well? How do you kind of help meet people where they're at, to hear their concerns, and then help guide them to address those concerns and kind of maybe help some more folks move towards getting vaccinated. So keep your eyes open for that. And then if you are ready to go, start working through the DHS checklist, which Ian, if you can go ahead and throw that in the chat, figure out what is this going to look like in your church community. our panel shared that they are open to facilitate questions if you have any. We are available at the council. Just reach out to us and we can help answer questions, help get you connected, get your community connected to people in your area, or get your community connected to people who can answer your questions. This is kind of, I've always said, this is a group project. And so we are in this together. And so thank you all for being in this group project with us together. And thank you for joining us tonight for this vaccine clinic outreach training. I hope you all have a good evening. Thank you so much.
Thank you.
Thank you so much.
Bye-bye.